Health Check with Nurse Jenn is presented by Island Cancer Center.
Half a day, I'm Nurse Jenn. It starts off as a pimple and slowly you notice it's painful, red, and swollen. And now it's a boil. The medical term is abscess. A boil is one of the most commonly diagnosed medical complications here on Guam. A boil is a tender mass filled with pus, bacteria, and debris. Most people definitely know it's a boil when it becomes painful and warm to touch. The most common boil sites are in warm, dark, isolated areas such as the armpits, groin area, and upper and lower back area. Causes occur from broken skin, minor skin trauma, or a small tear when sweat or dirty oil from a sebaceous gland or hair follicle or a pre-existing cyst trigger leading to the eruption of a boil. Other risk factors for an abscess include exposure to dirty environments, exposure to persons with certain types of skin infections, poor hygiene, and poor circulation. In addition, generally people with weakened immune systems such as cancer, diabetes, and chronic steroid users can get abscesses more often. Not typical of other infections, a boil is usually treated with both antibiotics and a simple procedure called an IND, incision and drainage. The doctor will make a small slit over the abscess and then proceed to drain out the bacterial pus. Sometimes draining can occur on its own, but generally it must be opened with the help of a warm compress and/or manually squeezed and drained by the doctor. Now let's play this week's holiday trivia. Indicate which is the proper method to treat a boil at home. A. Stick a clean needle into the center of the boil to drain the infected blood out. B. Wash hands, squeeze, and press boil repeatedly until white pus drains out. Or C. Apply a warm compress to the area for 30 minutes up to 4 times a day. The answer is C. Applying warm compresses is the preferred self-help option, but not if the boil is larger than 1 centimeter. You have a fever, or it becomes bigger and more painful, or if you notice red streaks, which means the infection could be spreading towards cellulitis. Thanks for hanging out with me. See you next week, same place, same KUAM channel. I'm Nurse Jenn reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jenn is presented by Island Cancer Center.